This has been an extremely rich and vital debate on absolutely crucial amendments, if conducted in two parts. And I want to rise quite briefly to offer the Green Group's support for all of these amendments, and aim not to repeat anything that's been said, but to offer some uniquely green perspectives on these set of amendments. And I'm going to take them in two groups. First of all, 170 and 173, in the names of the Noble Lady Baroness Cumberledge and Noble Merrin. And I think these are particularly important because they very clearly and explicitly lay out the responsibility of the Secretary of State. Now, when I moved some amendments last week talking about the Secretary of State's duty to provide, they met with something of a frosty reception in some quarters, but I think it's really clear from all sides of your Lordship's House that it has to be the responsibility of the Secretary of State to ensure that there is a plan for the workforce. And I think it's worth stressing that is coming from every side of your Lordship's House. And I think it's worth going to the King's Fund briefing, which I don't think anyone has mentioned yet. Just a sentence in that. The measures in this bill to address chronic staff shortages remain weak, close quotes. That's what a respected outside observer says your Lordship's House is seeking to plug that gap. And I think the Noble Lord Lee suggested that this was all terribly difficult, and that's undoubtedly true, but there's been a lot of people thinking about this for a very long time. I was at a briefing for the Royal College of Royal College of Physicians, and this was, I know it was before the pandemic, it was in person and there were no masks in sight. And there they were talking about the need for this workforce planning more than 2 years ago and saying, we know how this should be. And indeed, if you look at their, the Royal College of Physicians website, there's more than 400 of organisations who are backing these amendments for workforce planning. So the support is very much there. And I think that's focusing particularly on the medical side of things. I think I want to also go to the Age UK briefing, which when we're thinking about care workers, and we've had some very valuable contributions from the Noble Lady Baroness Verma and the Noble Lady Baroness Hollands in this area, but Age UK is looking at the way we need to look at this much more broadly, that they're calling for a robust accreditation scheme for care workers working in CQC accredited facilities. We need a different system. And I think it was the Noble Lady Baroness Hollands who talked about how this is a low-pay sector. I think we also need to talk about this differently and recognise this is also a high-skill sector. The job of providing care. I think of some of the care workers I've met, care workers who cared for doubly incontinent, aggressive, advanced Alzheimer's patients, and who'd done it for decades. And anyone who tries to claim that is not a person with an amazing level of skills, really is just denying the obvious fact. And we need to acknowledge that skill of care workers and need to make sure that it is actually appropriately remunerated. Now, I want to pick up to another perhaps specifically Green Party point that no one else has picked up on, starting with the point that I noted that the Chief Executive of NHS England was recently forced into a new deal with private hospitals, which she said did not provide good value for money. And this was providing more care in private hospitals to recover from the COVID pandemic, which sees the government going against NHS England and deliberately pushing up the role of the market in healthcare, which those who deny that's happening, I'm afraid that's very clear evidence of it. And I go to a report for the Centre for Health and Public Interest, which very much notes that the great majority of private hospitals rely entirely on NHS staff contributing outside their NHS hours on a self-employed basis, and we're talking about here about doctors and associated health professionals, anaesthetists and other clinicians. The NHS paid for their training, the NHS pays for their pensions, the NHS covers their insurance, and yet we talk about the private hospitals helping the NHS. And listening to this debate, I'm really thinking that perhaps as part of the amendments on report, we need to be thinking about, when we're thinking about workplace planning, we need to think about the financial contribution to be made by the private sector to the cost of training to adequately recompense the NHS for then what the private sector gets out of it to make profits. I come now to a second group of amendments, 86 and 214, which is looking at local responsibilities. And I do just want to really make the point that in many cases the needs are local. And if you train up local people who are already embedded in the community, they're very likely to stay in the community. And that's why it's crucial that we do have local plans and training pathways through. So, someone who's a care worker might want to take those care skills and then become a nurse and maybe become a doctor over a lifetime in learning and education, bringing all the different skills together and staying in one community and bringing those skills to one community. And I think it was an earlier debate, the Noble Lady Baroness Brinton referred to the problem with the shortage of dentists. And we've just had out the Great British Oral Health Report. And just one stat from that really struck me. In the Northwest, 22% of people have not been able to register for a routine dental appointment. This is just the kind of supply problem we're seeing all the time. And in the Morecambe Bay area, there are only 49 dentists for 100,000 people, which is obviously grossly inadequate. Now, I just want to make one final point, which is picking up points from particularly the Noble Lord Coker and the Noble Lady Baroness Whittaker about the global aspect of this. And there was a recent report from the International Centre for Nurse Migration working with the International Council for Nurses. There is now a global shortfall of almost 6 million nurses. And on top of that, it's estimated that 13 million more nurses are needed over the next decade. And the whole workforce currently is 28 million. And I think this picks up a point that the Noble Lord Patel raised about pay erosion for all medical professionals, but it's particularly evident with nurses. And the Noble Lord Lee again said it's difficult to plan. We have to acknowledge that any medical professional in the UK potentially can take those skills and find a ready place to use them all around the globe. We know there are many British doctors who have gone to Canada, Australia, nurses the same, all around the world. We are a wealthy country. Traditionally, we've imported these skills, all too often from places that have a gross shortage, even far greater shortages than we have. We have to stop doing that. We actually have to train more people, significantly more people than we need, because quite a number of them will, for whatever personal reasons, decide to go elsewhere, even if we're providing them with the best possible working environment we can. So we have to train vastly, vastly more people. That's our global responsibility.